Let's talk about pigmentation. So in terms of pigmentation, all of us want flawless skin. So let's think back when we were a baby and we had this clear, flawless skin. As we age, what we're noticing, we're having shadowing on our face, whether it's just general sunspots or freckles or hormonal shadowing in certain areas. We're noticing that we're getting a little bit of darkening and we're not getting that flawless canvas or the perfect canvas that we're looking for. And the reason why this is happening is pigmentation can be caused by genetic factors, hormonal factors. So let's step back a little bit, a gift from the family. It can be caused by hormonal factors such as post-pregnancy or the oral contraceptive pill. It can be caused by environmental triggers such as sun damage. So we have to look at what's causing the pigmentation. But on a cellular level, what's happening in the medical layer of the skin cells, there's a cell called melanocytes. And normally they sit here and they behave really nicely, but with age and cellular turnover, the melanocytes move up with the extrinsic triggers and the intrinsic triggers, and extrinsic being sun, moves all the way up to the beauty layer of the skin, the epidermis, and they fail to go back down. And that's when you notice that you get a tan, or you might turn around and you've got some freckles coming out a lot more, or you've got some pigmentation that you never had. So we're triggering it. What we want to do is we want to move down the melanocytes all the way back down to the medical layer of the skin, and we want to stop something called melanogenesis. We want to stop melanin production so we don't pigment so easily. And in terms of the modalities and approach of that, it depends fundamentally on your skin typing. So fair hair, fair skin, you can use laser modalities or you can use skincare, prescription grade skincare to move the melanocytes back down and to stop the melanogenesis. In other skin typings, such as dark skin, dark hair, Fitzpatrick 3 upwards, it's a little bit more difficult, and especially in genetic, such as dark circles, it's a little bit even more difficult to lighten the pigmentation. So over here we have to look at other factors, and the way we approach it has to be slow and controlled. Because what we can do is if we approach pigmentation too aggressively, such as deep peels, such as lasers, and you might turn around and be super happy for a little bit and go, oh my God, my pigmentation's gone. What you will notice is something you might trigger. It's called PIH, post-inflammatory hyperpigmentation, which means that suddenly the pigment's disappeared in this area, but a year later it's come in different areas because you've triggered the melanocytes. So in terms of pigmentation, you have to go in a very slow and controlled manner. And the way I describe it to my patients is, you've had your skin your whole life. It's going to take me 2 to 4 months to give you pigment-free skin, and we normally aim for 90% correction, but we tell them 70% because we just want to lower expectations. But what happens if you go in a very slow and controlled manner, and this is key, because you want to push down the melanocytes slowly down, and you want them to remain. If you trigger them too quickly, they go back up in other areas. So be very careful with the modalities you're using in terms of treating pigmentation.